Oh, Trish, you're muted though.
Can you hear me now?
Yeah, that's great.
Okay. So my name is Trish Miller, and I work at Nationwide Children's Hospital in their mood and anxiety program. And I also see the kids that Renee consults with us on in the FBIT Family Intensive Base Treatment Program here. But one of my other jobs is working with the children they're actually 12 to 18 in the anxiety intensive outpatient group that we have here in the mood and anxiety program. So I'm going to be talking about anxiety disorders in youth. And I thought we'd watch a little YouTube video for a minute, just kind of summarizing what the anxiety disorders are that we see, that we diagnose here. And so I'll play that for a minute and then we'll move on.
And
Check
Trish, are
right
you
now.
able to share your
I'm
screen?
Whoop.
Yeah, I think we lost it when we went to breakout rooms.
Oh. I'm not sure.
Or Kara has them. She could share the videos within the PowerPoint.
Can you see that?
Not yet.
Trish, you just have to reshare, like you did before.
Okay.
Or Jamie, do you have the slides up? Let me get them real quick.
I sure do. I can go ahead and share for you, Trish.
Thank you, Jamie.
Thank you. Hang on. I think I'm getting back to the right.
I was gonna say, because I know you can do it because you did it. Yeah, there's beautiful flowers.
Yeah. Let's see. Can you see that?
Yep, and now we just need the slideshow and then
Okay.
Yep, just from beginning to the left there.
Okay.
And then you'll just want to swap that again because we see the presenter view. There you go.
Okay.
Perfect.
Okay. Looks
Great,
great.
guys. All right. Can you see the YouTube video there?
Yep.
Okay. So he's going to talk with us briefly about the different anxiety diagnoses that we see.
It looks like we don't have sound. Here, I'll just go ahead and share for you, Trish.
Mm-hmm.
Sorry, folks. Give us 1 second. There's these two buttons when you go to share sound and optimize for video clip. So it helps.
Everyone worries or feels anxious sometimes. It can come and go, it can wax and wane as our lives change. But for kids with anxiety disorders, the feelings of worry and fear can become all-consuming. These anxieties can be unrealistic, they can be overwhelming, and they can be very persistent. They can't be talked or reasoned out of it, and kids who suffer from this know it doesn't go away. When a child's anxiety begins interfering with their ability to live life or causes them to withdraw from family, friends, and activities they once enjoyed, it's really time to get some help. Understanding the different kinds of anxiety disorders can help kids get the treatment they need to feel better. In this video, we're going to take a quick look at the different kinds of anxiety disorders. First, we're going to talk about separation anxiety disorder. Children with separation anxiety become extremely upset when they're separated from their parents or caregivers. This isn't just occasionally clinging to mom or dad at daycare drop-off. That can be really normal. This happens when it's serious, when it's intense distress that doesn't get better and can seem really unusual for a child's age. So some of the signs of separation anxiety include worrying about parents getting sick or dying, worrying about caregivers getting lost or kidnapped, not wanting to actually go to school or refusing to go, or having meltdowns when it's time to separate from caregivers that don't really resolve within a few minutes. Separation anxiety mostly affects younger children, but it can also be present in older kids and even teenagers. Next, let's look at social anxiety disorder. Children with social anxiety disorder are painfully self-conscious. They can find it difficult to hang out with peers or participate in class because of this overwhelming fear or anxiety they will do something embarrassing. Gatherings like parties or big gatherings like sporting events or parades can also trigger a lot of social anxiety. Some signs of social anxiety include an extreme fear of doing something humiliating, avoiding social situations, feeling panicky during social situations, like some older kids may report that they're shaking or they're sweating or they're short of breath, while younger kids may have tantrums or they may be really tearful or cry. Kids might also worry that people are going to judge them for being anxious, or they might be reluctant to meet new people or try new activities. We can also look at selective mutism, which in a way is what we would consider a very extreme version of social anxiety. Children with selective mutism have a hard time speaking in some places, like at school, and particularly when they're outside the home. Their anxiety goes beyond typical shyness, and it does not resolve over time. Selective mutism is sometimes treated as stubbornness. People might think it's willful, but it's not that kids won't talk. It's the fact that they can't even begin to talk, even when they badly want to. So much is the impact of their anxiety. So some signs include a child who seems frozen with anxiety or might have a facial expression that's kind of flat when people are trying to speak to them outside of the home. And in reality, with selective mutism, children who are able to speak in some places but not others, for example, they might be unable to talk at school but have no difficulty speaking at home, that's kind of normal in the sense that parents will often tell us, oh, well, they speak just fine at home, but talking to a close family member or being outside the home causes them to freeze up. And that's really where the impairment comes in. The next disorder we're going to talk about is generalized anxiety disorder. Kids with generalized anxiety disorder, or GAD, experience overwhelming, unshakable anxiety about a wide variety of things in their lives, especially their performance in school, in sports, or their interactions with friends and loved ones. These worries are unrealistic, they're pervasive, and they don't go away. Kids with GAD may seem irritable, they may withdraw from friends and family, or they might talk about their worries fairly constantly. Or some kids, particularly young children, can report having physical symptoms like headaches or stomach aches that really are an expression of their anxiety. Other signs to watch out for are kids who say they feel out of control anxiety about many different things. Another thing to watch out for is kids who are very, very perfectionistic, because it might be that their mind is kind of constantly spinning around that perfectionism and around wanting to do perfectly in school. And then there are kids who also might report that their anxiety makes it so they have trouble falling asleep or staying asleep, or that they wake up and they're really anxious, any kind of trouble sleeping, or they feel really exhausted. Now we're going to look at panic disorder. When people talk about having panic attacks, that can be colloquial, and it may not necessarily really be what we mean when we're talking about the clinical severity of panic disorder. But if someone is having a clinically severe panic attack, panic disorder is usually at the root of the problem. Children with panic disorder have a history of panic attacks, which are very scary and very sudden surges of symptoms that can make kids or teenagers worry that they're dying or going crazy, or that these symptoms are never going to end. They're never going to escape. Some signs of a panic attack include a kid telling you their heart is racing, or that they're sweating a lot, or that they feel like they're shaking, or they feel really dizzy, or they have a certain shortness of breath. Kids can also report at times they're worried they're going to die, or that the panic attack is actually going to stop them being able to breathe. Panic attacks are serious, but they're not dangerous. Kids may worry they're having a heart attack or dying, but once the attack passes, they will be okay. That said, panic disorder can be very frightening, very distressing, and can prevent kids from doing many things and going places they really enjoy because they fear that they might have a panic attack. Next, we'll look at specific phobias. Children with specific phobias have extreme fears about a particular thing. These things aren't typically considered dangerous, but can seem very scary to the child, and they're not something they can just get over. There are 5 common types of phobias. So the first type that we categorize is the animal type, or avoiding animals and bugs. The second type is the natural environment, where you might think about storms or being afraid of heights or being afraid of going in the water. The third type is blood injection injury, which might involve avoiding things like seeing blood, getting a shot, or having an injury that would cause you to bleed. The fourth type is situational, avoiding things like tunnels and bridges and flying. So the last type, which might include a number of things in that category, might include things like avoiding loud sounds like choking or vomiting, which many people find distasteful, but people with specific phobia actually find incredibly distressing. Next, we'll look at obsessive compulsive disorder, or OCD, which also involves intense anxiety. Children with OCD can experience disturbing thoughts, worries, or impulses called obsessions, or they can also develop repetitive actions called compulsions to calm the anxiety caused by their obsessions. So some signs of OCD can include repetitive hand washing, repeatedly lining things up or performing a certain action a set number of times, or repeatedly asking for assurance from adults well beyond a question being answered. All the anxiety disorders we've discussed today can be treated with evidence-based therapy. That can be cognitive behavioral therapy. It can also be called exposure and response prevention, and it's sometimes in combination with medication. Treatment can be very effective in helping kids get free from anxiety that's dominating or limiting their lives. If you're concerned that you or a child you know may have an anxiety disorder, I encourage you to reach out to a mental health or medical professional in your area and make an appointment. To learn more, visit the Child Mind Institute Family Resource Center, which has hundreds of articles and guides to help you support children who are struggling with mental health or learning disorders. You can find the link in the description below. I'm Dr. Dave Anderson, a clinical psychologist at the Child Mind Institute. Thank you for watching. And if you found this video useful, please like and subscribe.
So the children that we work with go through what we teach them about is the cycle of anxiety, where the anxiety produces a situation that leads to symptoms which the child usually tries to control by avoiding the anxiety-producing situation, which provides short-term relief, which then leads to more that, because that coping style works, then it leads to more avoidance. So the fear that initially led to the avoidance worsens, and the anxiety is worse the next time avoidance will be more likely used as the way to cope with the anxiety. So when the child is avoiding, a lot of times we see them using safety behaviors, which are subtle things that they use, like putting their hoods over their face, or maybe talking very softly so that it's hard. They don't have to be very showy about their presentation. It creates a feeling of safety, but it also looks like the person is really not engaged and unfriendly, and again is avoiding and not facing their anxiety or their fear. Safety behaviors might include saying yes, even if you really don't want to do the activity, or things like turning down invitations. You probably all have kids that move pretty quickly to homeschooling or online schooling when they're very anxious at school or socially anxious with the other kids at school. Maybe even using drugs or alcohol. And we can go to the next slide. And then the parents use what we call accommodations. And so it's a whole family system that's involved in maintaining this pattern that actually perpetuates the anxiety for the youth. Family accommodations include, maybe it's any action that a caregiver might do or not do to try to help manage the child's anxiety, which could include speaking for the child, ordering food for the child, excusing the child from school or class, maybe participating in their OCD rituals so that they can just keep the kid moving along and not getting stuck in the behaviors that they're doing, or providing a lot of reassurance. And then that continues to make the youth feel that they're not really able to handle the anxiety producing situation without the parent making the accommodations. When we see kids for anxiety in our program, we can go to the next slide. We have to differentiate between other things that are going on for the child so that we are targeting the anxiety in a way that makes sense and that they could benefit from the group. A lot of times adjustment disorders might appear to be similar to anxiety disorders, but the adjustment disorders are of a brief duration and they're related to situational stressors pretty much only. Or depression, you might have somebody who's depressed and their motivation is low, and it can look like the avoidance of anxiety. So you have to screen for the depression. Next slide. ADHD can look like anxiety and the inattention, the difficulty focusing, the constant activity if they're hyperactive, and the aversion to mental effort can look like avoidance. And autism is another one. In fact, the inability to read social cues for kids who have ASD can look like social anxiety. And I think there is a significant amount of anxiety with neurodivergent kids who are having trouble reading cues. They might be having trouble with either academics or the social interactions that they don't really have the ability easily to navigate the nuances of those situations. So you can see a lot of anxiety, but there are some factors that make it so that it's difficult to tease apart what part of it is neurological and what part of it is and developmental and what part of it is anxiety to treat. Trauma-related disorders, the next slide, where you can see hypervigilance, flashbacks, avoidance of the trauma triggers can present as anxiety, and the physical symptoms that a youth might feel when they're feeling the triggers from trauma might present like anxiety and avoidance. Substance abuse is also something that you have to look at in terms of whether or not the use of substances is increasing anxiety, or the withdrawal from any substances can cause some difficulty that looks like anxiety, but it's really substance abuse treatment is needed. The next slide are we use a couple of assessment tools to screen for anxiety in the kids that we're admitting to the program or the kids that I'm seeing individually for medication management. We use the SCARED, which is the Screen for Child Anxiety Related Disorders. It's widely used, and it's a good screening tool. It's reliable, valid, but different informants can have different responses to it, which sometimes is a little bit confusing. But we use that with every child coming into the program, and then we use that again later on in the program to see what their improvement might be from our interventions. The GAD-7 is another measure that asks the patient to evaluate their own symptoms, and we administer that at the start, middle, and end of treatment to track the progress of the kids going through our program. It's really kind of fun to be able to see how they improve. And we do a family component to the anxiety IOP also. parent sessions with a family therapist, and she evaluates family accommodation and the family dynamic factors that are contributing to the child's anxiety. And she uses the family accommodation scale, which is, it measures the degree to which family members are accommodating to the patient in the last month, so that she can see how significant their contribution is and what she needs to work with in these families. Next slide. So the components of treatment for kids who are experiencing significant anxiety or any of those anxiety disorders that we talked about at the beginning. We use medication management, individual, family, and group therapy, which consists of CBT, DBT. Exposure and response prevention is probably the main thing that we do during the course of our IOP group for those kids. And we do some teaching in the group for the children about, we can go to the next slide. We do some teaching about the biologic, that didn't come through to you guys. The biological nature of I'm not sure why that's, oh, there it is. There you go. Okay. The biological nature of the manifestation of anxiety, which has to do with brain chemistry and the way that the kids are wired. We don't get too technical with the kids, but just enough to have them understand that their experience of anxiety is not their fault. They're biologically a lot of times wired in a way that contributes to that problem. And then there are social factors that contribute, that mostly have to do with the validation or invalidation of their environment. So it could be members of the family, teachers, coaches, how those people are interacting with the vulnerable to anxiety youth, which has a lot to do with how significantly the anxiety develops for that youth. And so it helps the kids not feel like blame is being placed on them as kids that have psychological problems, and that it's a host of factors, and that we're going to try to help the youth become more resilient and learn how to cope with those things that they can to try to manage their anxiety. So we're going to go to the next slide, are the individual factors that that contribute to a child's anxiety, which of course has to do with their temperament.
Excuse me, Trish. Sorry to interrupt, but are you able to wrap up the slides here in the next minute or so, since we're at noon?
Yes.
Thank you. I know we had a bumpy start, but
Yeah, sorry about that.
that's okay.
So I'm going to go probably down to the skill development, which is slide 26, if you can go all the way down to skill development. And the skills that we're trying to teach, along with giving medication, helping the families understand how they're contributing, even though they feel like they're helping, is that we teach mindfulness, emotion regulation, distress tolerance, interpersonal effectiveness, and thought challenging during the group for the kids and in their individual sessions. The families work on their accommodation and a behavioral plan, usually for the kid during the group. And the anxiety intensive outpatient program, this is just a definition of it, it's a 4-week skill-based group. And each week the group focuses on the development of different skills And we actually do weekly development with the kids of exposures where they rate their anxiety on a scale and look at how being exposed to the anxiety producing situation that they have a hand in creating to practice dealing with, how their anxiety goes down as they face that exposure rather than avoid it. So I am going to go to slide number 31, how exposures affect anxiety. And then we're going to be able to end. So exposures don't create new learning. We slice it thinner to make it more doable. So we have the kids gradually create exposures each week in the program to help them to learn to expose themselves, learn to cope with the anxiety that they're experiencing, and then see that their anxiety goes down and give themselves kudos for going through the whole process so that they can go back to school and socialize and do all the things that they want to normally be able to do. And in the meantime, I'm helping with medications in the background. And that is pretty much, you can go to the yoga person. Pretty much the end of the slideshow. I skipped some about medications and things and scales and things like that. But do you have any questions?
And folks will receive the whole PowerPoint with all of the excellent content in there. Yes, but for now, any questions for Trish?